Multiple system atrophy, what to expect for you and your loved one. Multiple system atrophy, or MSA for short, is a rare neurodegenerative disease that affects about 4 in every 100,000 people. It affects men and women equally, and early symptoms usually appear around the age of 50. MSA causes loss of motor control and automatic body functions due to neuron degeneration affecting 3 important parts of the brain: the basal ganglia, cerebellum, and brainstem. Depending on which part of your brain is affected first, you will be diagnosed with one of 2 types. In MSAP, the basal ganglia are affected first, and with MSAC, the cerebellum is affected first. However, eventually both types will overlap, and you will experience symptoms related to all 3 brain areas degrading. If you're diagnosed with MSAP, the first symptoms you'll experience are related to degeneration of your basal ganglia, which facilitates movement. You can expect to feel rigid muscles, difficulty bending your arms and legs, slow movement called bradykinesia, difficulty with balance and posture, and tremors. These symptoms are very similar to Parkinson's disease, and as a result, MSAP is frequently misdiagnosed as Parkinson's. If you're diagnosed with MSAC, the first part of your brain affected is the cerebellum, which coordinates and fine-tunes your movements. You may notice that when you reach to grab an object, your movement isn't as smooth as it used to be. You can expect to feel unsteady while walking. You may experience slurred, slow, or quiet speech called dysarthria. You might have trouble with your vision and difficulty swallowing or chewing. Degeneration of the brainstem also occurs with both forms of MSA, and this affects something called your autonomic nervous system. This controls unconscious body functions. One common symptom of MSA is called neurogenic orthostatic hypotension. This is caused by a lack of blood pressure regulation by your brain when you're sitting down and standing up. As a result, when you change positions, you may experience lightheadedness due to a lack of blood pressure control. Bladder dysfunction is also common in patients with MSA, and breathing disorders and REM sleep behavior disorders frequently occur as well. The rate of progression of MSA is different for everyone, but generally symptoms progress over the course of 5 to 10 years. You can expect to experience a gradual loss of balance and movement coordination. On average, after about 3 years, patients require a cane, and after about 5 years, they will require a wheelchair. Unfortunately, many patients lose the ability to move completely by about 7 years and are bedridden, and eventually the disease is fatal around 10 years. You may eventually need a caretaker to assist with everyday activities such as cooking, cleaning, writing, and washing. As well, you can expect to need adaptations in your household to help accommodate changes in your mobility, such as rails or increased space to move around. There's no cure for MSA, but many treatments are available to reduce symptoms and improve your function. One very effective form of treatment for MSA is physical activity. Aerobic exercise has been found to slow the progression of neurodegenerative diseases, and strength training can help you maintain your mobility. However, it's important to consult with a physiotherapist to ensure that the exercises you are doing are safe to perform, as MSA can make exercise difficult. Some commonly accepted safe exercises for MSA are seated rowing, cycling, and gentle lower body strength training. Your doctor may also recommend diet changes to help manage blood pressure. Reducing alcohol consumption and increasing salt and fluid will help combat effects of orthostatic hypotension. As well, it's encouraged that you increase your fiber intake. Medications are also commonly prescribed to manage symptoms. Midodrine or droxidropa help increase your blood pressure to reduce orthostatic hypotension. Levodopa or carbidopa help with stiff muscles or tremors. These 2 are the most commonly prescribed, but some additional ones that are also prescribed are melatonin to help reduce sleep disorders and insomnia, SSRIs to help reduce depression and anxiety, and Botox injections to prevent pain from muscle contractions. There are also many forms of therapy that may be recommended to you. Physical therapy can help maintain your mobility, and occupational therapy can help with home safety and new ways to tackle your activities of daily living. In your MSA journey, you may experience emotional instability, anxiety, or depression. While this is common, do not hesitate to speak out to your loved ones and seek help from a psychologist or therapist. Lean on those around you for support. Within recent years, there have been a number of support groups and nonprofits that have risen to help bring attention to MSA. If you or a loved one is diagnosed with MSA, reaching out to these organizations can help support you in your journey. Some of these organizations include Multiple System Atrophy Awareness and the MSA Coalition, which provide donations to research and support individuals suffering with MSA. If you'd like to help raise awareness and fund research for MSA treatments, there are many opportunities to get involved. October 3rd is World MSA Day, and there are many initiatives you can join, such as A Mile and a Candle for MSA. By raising awareness, we hope to find better treatments for MSA and hopefully someday find a cure.